Hello, I'm Lori Vick. On behalf of the Healthcare Compliance Association, welcome. In today's environment of healthcare reform and an emphasis on the quality of healthcare, the role of compliance is more critical than ever. Today, we're going to explore that role with key government officials and leaders of healthcare compliance who share their insight on implementing and sustaining an effective compliance program. Healthcare providers pay close attention to the activities and pronouncements of the Office of Inspector General. The OIG's mission to prevent, detect, and correct fraud, waste, and abuse should be aligned with the goals of an effective compliance program. Daniel Levinson, Inspector General, U.S. Department of Health and Human Services, explains the mission.
We really have a twofold mission. One is to detect and prevent fraud, waste, and abuse. And we do that primarily through our investigative mission. But we also have a very important co-equal obligation to promote economy, efficiency, and effectiveness in the delivery of services by Health and Human Services, very importantly in both Medicare and Medicaid.
Healthcare in America is facing unprecedented challenges. While providers struggle to understand the impact of healthcare reform, the cost continues to soar, as does the number of people who rely on Medicare and Medicaid. In preparing for the future of healthcare, organizations need to consider compliance as an integral part of their business operations.
As a result of healthcare reform and the focus that it places on value and quality of healthcare, that the compliance operation becomes really an integral part of the health and welfare of the entire enterprise. It's very important that the compliance function report directly to the board. We need a relationship that is direct and that is personal, so that the directors of the operation are familiar with how the compliance process is actually being implemented in their institutions.
The governing body of a healthcare organization plays a key role in ensuring there are adequate controls and systems in place to identify misconduct and address emerging risks. Let's hear some key questions board members consider in carrying out their fiduciary duties.
The simplest way for a board to approach this is with TACT, T-A-C-T. First, you want to ask the question about transparency. Are we prepared to have systems that track and report data accurately? Next, accountability. Do we have systems in place that will allow us to identify and repay funds that we should not have received? Compliance, or the C in TACT. Do my compliance officers and compliance team understand the broad scope of what is now in their responsibilities? And finally, T, or training. Do my clinicians understand that quality is part of compliance? It is more important now than ever to have a compliance program. Under the healthcare reform, all providers are going to be required to have compliance programs in place. And even if that law didn't exist, there's a very good common sense reason to have compliance. A compliance program is like a seatbelt. You want to wear it all the time, even if you never intend to get into an accident.
Compliance programs have historically been voluntary for companies not subject to a corporate integrity agreement. With healthcare reform, having an effective compliance program is becoming a requirement. Jim Sheehan, Medicaid Inspector General for the state of New York, where compliance is a requirement, talks about the crucial role of the compliance officer.
In New York, what we have observed is that the compliance officer makes a huge difference in ensuring that compliance is part of the DNA of the organization. But the other thing it does, they become the face of the organization for us. And earning the trust of regulatory agencies on minor issues means when you face a major question that you start with that base of trust.
Experts agree that the best compliance programs are woven into an organization's culture and evident to employees, the public, and regulators alike.
What is the public evidence that your organization is committed to compliance? Are there signs on the walls? Are there people who are actively involved in this activity? Does your website show that you have a compliance program, how it works, and how to access it.
The best way to have a strong compliance program is to make sure it's worked into the daily fabric of your organization. You've got to do compliant things every day. It's not a moment or an experience that you do every now and then. You do compliant things every day. And our goal is really to get to a place where our employees aren't even thinking about it, where it becomes natural, it becomes part of our business practice and our business model to do things the right way the first time and every time.
In this time of industry transformation, companies who integrate compliance efforts into their business planning are making a commitment to a healthy future. Jenny O'Brien, Chief Medicare Compliance Officer for United Healthcare, shares how the Healthcare Compliance Association has created value for her organization.
HCCA is a great organization to help the profession be ready for this ever-changing healthcare environment. An organization such as a healthcare compliance organization is a great place to come to get resources, to get tools, to network with other professionals, and to listen to other people share their stories and their lessons learned about what works and about what hasn't worked and maybe a more effective way of getting there.
Attracting and developing experienced compliance personnel is a sound investment.
The best reason to continue a compliance program is quite simple. You've demonstrated you know how to do it right. You don't want to stop compliance. You want to build on compliance.
Healthcare is indeed an ever-changing environment, and healthcare organizations must be flexible and responsive to that change. By implementing the expert guidance we've heard today, your organization will be prepared to develop and sustain a healthy, enduring compliance program. Thank you.